I'm very excited to be here partnering with Johnson and Johnson so that we can educate others what schizophrenia actually is, because it's very complex and it actually affects about 2.8 million individuals just in the United States. And it has a variety of symptoms, including those that we might be familiar with. Positive symptoms, hearing things, seeing things, paranoia, but it also contains negative symptoms, which are symptoms that take away from the patient's baseline level of functioning, can affect motivation, cause people to isolate themselves. But it also has cognitive symptoms, which impacts the way the individuals might communicate or their thought processes. So it's imperative that we treat these symptoms effectively and avoid damaging relapses that can occur during the illness. It's imperative that we effectively manage schizophrenia, particularly within that first 3 to 5 year period after diagnosis. This is the critical period when we really see the condition progress most rapidly. And treating symptoms effectively with things like long-acting injectables such as Invega Sustenna could positively impact outcomes for our patients.
To begin with, at his first symptoms of psychosis and his first psychotic break, it was like living in a nightmare. Um, Trying to find your way out of it, or are you going to wake up from it? Fear and anxiety that was paralytic at times, self-blame. Is this something that I did to him? Or blaming drugs and alcohol. At that point, I realized I needed to educate myself as much as I could on schizophrenia through books, YouTube, anything I possibly could get my hands on to sort of feel what he was feeling or what was going on in his head. Um, and the worst symptom I realized is they lack insight into the disease. They don't realize they're sick. They don't think they're sick. And their reality is completely different in their head from ours. So thinking about that, he was constantly put on oral medication, which why would you take an oral medication if you didn't think you were sick? And plus, why would you take a medication that didn't make you feel well or gave you a lack of motivation instead of giving you motivation? That is where, through an advocacy group, I learned, which was a support group for caregivers, I learned about another caregiver's loved one that was on in the Johnson and Johnson Invega Sustenna long-acting injectable, uh, and how well their son was doing. So from there, uh, my son has been in remission for 10 years and doing very well, has a professional career, has met his professional goals. But I do want to clarify that what works for one does not work for all. So it's very important that you talk to your healthcare provider. And you, as the caregiver, are the advocate. You, in the beginning, are driving the bus. So talk to the treatment team about this.
As Katie mentioned, everybody's story might be different. Their journey with this illness could be different. So it's imperative that you reach out to your primary care provider and see what might best fit your treatment options. But if you go to treatyourschizophrenia.com, it has a wealth of information, including explanations about the illness itself, about long-acting injectables, and you can also reach out to a community mental health center, which offers a variety of different resources.